Hello, welcome to Chapter 1 of the American Healthcare System. I'm Jeremy Whitaker, your instructor for this course. Now, the healthcare system in the country is complicated. It's tough for consumers, it's tough for practitioners, it's difficult for everybody. As you can see in the first word, it's saying people spend thousands of dollars without knowing of what they're even going to pay for or how much it's going to cost, because if you need care, the price is fairly immaterial. About 20%, right now it's 17%, but it's on its way to 20% of the total economy of the United States is made up out of healthcare. And that's not just people walking into doctor's offices, that's pharmaceuticals, that's medical equipment, that's home healthcare, hospitals, clinics. So again, this whole range of services. Of course, the United States is pretty much the only developed country without a universal healthcare system. That's not positive or negative on us, but we have a market-based system. And then again, another important concept is prevention, even though this isn't a class about prevention. 3 levels of prevention, primary, secondary, and tertiary. Now, an example of that would say high blood pressure, hypertension. Primary prevention would be exercise and diet, so you never have the problem. Secondary prevention would be getting regular screenings. So we're moving the kind of prevention into more invasive, more medical-based. And then the tertiary, third level, would basically be after you already had a problem to prevent it from happening again. So let's say you had a heart attack and then you went on medication to avoid having a second heart attack. Now some milestones. The book actually spent a lot of time talking about the big milestones in these 4 areas: medicine and medical education, hospitals, public health, and the insurance system. Read through those, and you have an assignment about those. So again, take a look through the tables and make sure you understand the gist, kind of the history and how we got to where we are. Now, some other ideas from this chapter: the iron triangle of access, quality, and cost. Sometimes this is obviously the goal of most medicals, to improve quality, to improve access, and to lower cost. And then, who pays for medical care? There are 3 big payers you need to understand. The biggest is actually the last one, which is the government. And the biggest program, Medicare, far and away the biggest payer of health services in this country. They basically established the gold standard for payment, and everyone else bases their payments off of usually Medicare's reimbursement. Medicaid, which is for people with low income, that's whole families with low income. And then the final program you're going to hear about is CHIP, called Hawkeye in Iowa. And that's for children who are in that kind of middle area where they're low income, but not low income enough to qualify for Medicaid. Now, you often hear about private insurance, which is either people go to the health insurance companies or through a broker and buy a policy, or they get it through their employer. So that's most people of working age. They have private insurance if they don't qualify for Medicaid. Then also, a very small portion of the market is cash pay. People who without insurance who walk in and just pay, and that's the most expensive way to get health care, and often can be negotiated. So for some reason, if you end up without insurance in a doctor's office, don't pay the full tab, negotiate that down. Now, looking at the assignments for this chapter, there's an introductory quiz that's not just over, it's not over the reading, it's actually over the syllabus, the course schedule, my office hours, stuff like that. So look through those documents. You can take it up to 3 times. So give those a good read, but if you take it again if you don't get full credit. You have to schedule a meeting with me during these first 2 weeks of the semester. That can be either over the phone, face-to-face, or on Blackboard Collaborate, which is video conferencing through your computer. Again, I think it's fairly easy to work out. And then there's 2 assignments. One where you choose your favorite of the milestones and why it's the most important for each of the 4 areas we talked about earlier. And then there's a journal article that you'll need to go through and follow the instructions on that. Thank you for watching, and I look forward to handling your questions. Bye.